Hello, everyone, and welcome to today's press conference with Munson Healthcare. I'm Diane Mihalik. I'm the Chief Marketing and Communications Officer, and I'm really excited to have you join us today. Today is Tuesday, May 11th. Next slide, please. So in addition to these press conferences, other ways you can stay connected with Munson Healthcare include our e-newsletter. You can sign up at munsonhealthcare.org/newsletter. You can also follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. And as always, we keep our FAQs on munsonhealthcare.org as updated as we can. And as you know, things are changing on a daily and hourly basis, still related to COVID-19. And we have a lot of great information to share with you today, and we'll continue to update our website as needed. Next slide, please. So I'm really excited about today's speakers because, throughout the pandemic, we've tried to provide a lot of different perspectives and share a lot of different types of information with you through these press conferences. And joining us today, as always, or as usual, will be Dr. Christine Nefsey. She's the Chief Medical Officer for Munson Healthcare. Dr. Nefsey will walk us through some of our current hospitalization numbers and some general COVID-19 and vaccination updates. And then I'm really excited because today we're doing something a little different, and we are having 3 high school students who will be joining us to share their perspectives on the COVID-19 vaccine and some of their other viewpoints as well on the pandemic and what it's meant to them. Now, we've had a lot of different experts on these press conferences. We've had infectious disease experts, clinical pharmacy experts, quality and safety experts, OBGYNs. So again, we're just trying to give a lot of different perspectives, and we're excited to hear from these high school students today. Next slide, please. So without further ado, I'm going to hand it over to Dr. Christine Nefsey, our Chief Medical Officer for Munson Healthcare, for your update. Welcome, Dr. Nefsey.
Thank you, Diane. So I am pleased to report we continue to see a decline in our numbers. A couple of weeks ago, we had a pretty steep decline. That decline has very much leveled off. We are only going down about 0.1 percentage point in our case positivity rate, but we do continue to trend down. So you can see here we're at an 11.2% positivity rate. And you can see we are also at 361 cases per 100,000. Still higher than we would like to be. As a reminder, we'd like to be actually below 5% for our case positivity rate, but certainly trending in the right direction. Next slide. We currently have actually 48 patients across the Munson Healthcare system. Again, we've been holding steady around here for about the last week or so, significantly down from our peak, which was at 100 and for a while in the 90s, but still quite busy in our critical care units and ICU units, but again, trending down, certainly in the right direction. Slide. Here's our graphic representation. Hard to see that plateauing. I think we'll see that probably better as weeks progress, and hopefully that'll just be a steady decline. But you can see that steep decline and now kind of holding. Next slide. So lots of news on the vaccine front. Here you can see where we are for our for the state of Michigan. If we'll go to the next slide, here's where we are regionally. So this is Region 7, kind of our geographic catchment area for Munson Healthcare. And again, at a 56.6% vaccination rate, which is great news, certainly has helped us a lot in the last couple of weeks with this most recent surge, but still some room to go. Next slide. Most of you are probably familiar with this. This is the My Vac to Normal challenge that was given to us by the Michigan Department of Health and Human Services of reaching really milestones as far as vaccination and tying those milestones with lifting some of the mitigation factors we have in place. The state did announce yesterday that if you include numbers that aren't traditionally in our MICR, so with the Department of Defense and VA that we have reached that first 55% milestone. So we hope to hear from the state as time goes on in about 2 weeks about what that looks like for broadening the return to work parameter. Next slide. And this is just sort of a reminder of the benefits of being fully vaccinated, some of the things that you can do that would be considered risky for an unvaccinated person. Next slide. And I am happy to report that Munson Healthcare, again, in coordination with our mass vaccination clinics, our primary care clinics, and our local health departments, has given over 78,000 doses of vaccine. Next slide. If you have questions, we are doing some panel presentations where we can answer questions. You can reach those on our website, but we are trying to get as much information as we can out there. So these are available to you. Next slide. And as always, you can ask our Ask a Nurse line. Again, your primary care provider knows you best and is probably the best source of information for you, as they will know your medical history better than anyone. But the Ask a Nurse line is also available. Slide. So I'm happy now to pass that back to you, Diane, and hear from our awesome guests.
Sure, but right before we introduce our guest speakers, if we could go back a couple of slides to that town hall slide, I do just want to reinforce that these are meant for anyone in the community. So the first one's going to be on this Thursday from 1:30 to 2:30, and you can register on our website. But really, we are encouraging parents of students, especially now that we know that the vaccine may be opening up to ages 12 to 15. We know parents are going to have a lot of questions so we encourage you, if you know someone who can't attend one of these press conferences but may have a question, these town halls are another great option. Again, the first one's going to be this Thursday, and then we'll have another one on Friday, May 21st. So Dr. Nefsi, if we could just take a moment to talk about the recent announcement of the Pfizer vaccine reaching those approval stages for ages 12 to 15. Can you describe to us what else needs to happen for that to be begin to be implemented, and what do you know about the implementation of that in Northern Michigan?
Yeah, thanks, Diane. So the FDA did announce yesterday emergency use authorization for the use of the Pfizer vaccine down to the age of 12. They are expecting to hear from ACIP, which is the Advisory Committee on Immunization Practices, on Wednesday, whether they give their approval as well, which we anticipate they will. And then we will be okay to start vaccinating kids aged 12 and up. I know many of our health departments, as well as our primary care clinics, are preparing for that. We are also aware that a lot of parents, as you mentioned, will probably have questions on that. So, again, the same rigorous studies that on safety and efficacy that went in for adults, and in Pfizer's case down to 16, were put into place for the 12-year-olds. And again, thousands of children age 12 to 15 were studied for this. We have well over, I think, 150,000 just in the state of Michigan of 16 to 19-year-olds. So a lot of good studies going on about safety and efficacy of the Pfizer vaccine in our younger age groups. And once that ACIP recommendation is given, we will be ready to start vaccinating.
And Dr. Nefsi, are you still seeing younger age groups being hospitalized?
Yeah, that's a great point, Diane. We are, as we have seen a decline in our numbers from this most recent surge across the state, we have seen a really steady number of both pediatric admissions and ICU admissions. So our critical care units and intensive care units, both here in Northern Michigan as well as across the state, are having a high census. They are still pretty full with patients. And we have not really seen the decline in the pediatric admissions that we hoped to see. So those numbers are staying pretty steady.
Okay, great. And just one last question. Are we still seeing the variants in northern Michigan, and are there any new variants in the area?
We are still seeing variants, and we did just this week find a case of the Brazil variant in the state of Michigan. So the variants still continue to be present in the state of Michigan and of concern given their higher degree of transferability.
Okay. And does vaccination, can you explain, does vaccination help reduce the number of variants and the mutations that this virus is undergoing?
Yeah, absolutely. That's a great point. So what we know is the more people that get natural disease, so they naturally get COVID-19 and either recover or don't recover from it, but that spread is what drives the change and the variance. So that virus mutates when you naturally get the disease. People who are vaccinated don't get the natural disease. So that really ends the ability or the host to allow mutations to occur. So again, the more people we can get vaccinated, the lower we can get our percent positivity rate in northern Michigan, the less likely we are to have more variants come.
Great. Okay. Thank you, Dr. Nefsi. Appreciate those insights. Just wanted to work through a couple of those questions before we get to our other speakers here. So we'll have you back at the end after our students are able to speak, and we'll do welcome you back for the Q&A.
Sounds good.
Okay, next it is, as part of our journey for reaching herd immunity is ensuring that our younger generation is protected. And today we're excited to have 3 Northern Michigan students, high school students from the Grand Traverse area with us to share their perspectives. And as we all know, so much has changed for our school age population, and it's important to really hear their thoughts on COVID-19, how they are going about making decisions related to vaccinations, and just getting their perspectives. Like I mentioned, we've heard a lot of other perspectives here on this press conference. So the first high school student I'd love to introduce is Olivia Ludka. Welcome, Olivia.
Hello, thank you for having me.
So Olivia, I'm really excited to have you here. I'm looking through just some general information that you shared with us yesterday when we were preparing for this. So you're a high school student. You are captain of your color guard as part of your band. You are the student director of your high school's musical, and you are president of Students for Life. That's a lot. I don't know where you find time to do all that, but that's quite a few accomplishments.
Yeah.
And then it looks like you also plan to attend Ave Maria University in Ave Maria, Florida, where you'll be on the dance and color guard team, and you're interested in studying law and medicine, which are 2 very great professions. And just a fun fact I want to share with the audience that we learned about you yesterday is that Ave Maria University was founded by Tom Monahan, who's the former owner of Detroit Tigers and Domino's Pizza. And along with your other scholarships for color guard and band, you also received the Michigan Scholar Award from Tom Monahan and his wife. So congratulations on that. That's quite a few accomplishments.
Thank you.
So Olivia, we just want to hear your perspective on where you stand with vaccination, how you went about making your personal decision, and sort of where you're going for information these days.
Yeah, so it all started, I actually didn't want to get the vaccine at first. I have a ton of friends who are anti-vax and anti-mask, and along with that just comes the bandwagon effect of not wanting to get it. And so my mom forced me to get it. And then I emailed my professor because I was going to have an NMC class during my appointment. And I said, I'm getting my COVID vaccine. I won't be there. And he said, congratulations. I'm very excited for you. And that's when it started to realize that this is going to be a really cool thing. It's going to be a great thing. And then also, I just realized along with it, it was something that came with time, that caring for people in the sense of getting the vaccine so I can keep my grandparents protected and my mom protected. It doesn't have a religious belief or a political affiliation. I was very it was very cool walking in and being like, yeah, this is something I get to do. And then also just knowing that my mom will have a certain level of comfort with me going to Florida next year and me starting to hang out with friends again, because graduation's coming up, senior party. And it's just it was really cool for me to experience.
That's great, Olivia. So tell me a little bit about why you were hesitant at first. I know I have the same story, because when I first was offered the ability to have the vaccine as a healthcare worker, I was one of those people who was thinking, well, first of all, I'm going to let the elderly population have it first, because at that time there was limited supply in the area, and I thought, well, I'm pretty healthy, I don't really need it. And then as supply kept coming up, I was still hesitant, and then I thought about, okay, I'm caring for an elderly father. I would just be devastated if I was the one to get him sick. So that's really what changed my perspective. But what besides your mom kind of, nudging you into it, what were you most hesitant about?
I was really hesitant about the talk of embryonic stem cell research within the vaccines.
Yeah, it's a big
Being the
one.
president of Students for Life at my high school, that's something that was talked about a lot. And just from following certain Students for Life Instagrams and influencers, they just talk about how they're not getting it and it's not as anti-abortion as many people think. And then I really did my research and I collaborated with my mom, and she was like, we're going to get you the one. I got Pfizer. We're going to get you the one that is guaranteed to have no stem cell research. And that's how it's going to be.
Well, Olivia, I really commend you for educating yourself. And again, it is a personal decision. With these press
Yes.
conferences, of course, Munson Healthcare is promoting and advocating vaccines, because we know that will help us get to herd immunity. But we also know it's a very personal decision for everyone. So great work in educating yourself and making that decision. And we just would love to have you stick around for a little bit and bring you back for the Q&A session, because we know some people may have some questions for you. So
Definitely.
great. Thanks, Olivia. All right, next, it is my pleasure to introduce Ethan Rowe. Ethan, great. Thanks for joining us. And I know you are all masked up because you are in a semi-private area right now. So great job in keeping up all those mitigation efforts. So Ethan, you're a senior in high school and will be attending Northwestern University in Evanston, Illinois in the fall. Congratulations on that.
Thank you.
Yeah, it sounds like you're planning to study something in the science-based field. So that's exciting. And your interests include environmental activism, and you are one of the co-presidents of the Students for Environmental Advocacy Club at your high school. And you are also very active with the Michigan League of Conservation Voters. So really strong interest, it sounds like, in the environmental and activism fields. And just a few more credentials on you, because I think all of our high school students today have more credentials than I do. You're the media lead for your high school robotics team, and you're the second chair viola in the high school orchestra. And you've also, I know this too as well, you've performed in many productions for both your high school and the Old Town Playhouse. So you are another busy individual, and I'd love to hear from you sort of the same questions I just asked Olivia about where do you stand on vaccinations? How are you educating yourself? Where are you getting your information? And what did you ultimately decide?
Yeah, so when I heard about the vaccine being available, I was really excited because I had obviously heard that it was in the process for some time. And I really didn't have too many concerns with it because I obviously had gotten vaccines for like other things in the past, just like flu shots, etc., just throughout my childhood. And being that I'm going into like a science field, I really try to have my faith and trust in scientists, because that's going to be the community that I'm working with. So really just put my faith into that. And so I didn't really educate myself too much before the vaccine, because I'm like, I trust these people. And if they're saying it's safe and like thousands and millions of other people are also getting it, I feel like that I have enough trust in that I'm going to get the vaccine, especially because like as a high school and now a college age student, I see how many opportunities that people my age or a year older, a year younger are missing out on. And going into college, I want to be able to have the best college experience and access to education as possible, because although online education is possible, at least for me, I know it's not as effective, and many others it's not. So I'm really hopeful that by the time that this fall comes around and I'm going to school, that we're able to have in-person classes and have the full college experience. And so I'm really hopeful for that. And so I just want to make sure that everyone can be vaccinated, and that starts with me.
That's great, Ethan. That's just a wonderful story. Now, so it sounds like when you do go to college, you're just going to feel more protected, and it'll just allow you to do more, is what I'm hearing.
Yeah.
Okay.
I'm not super high risk personally, but I don't know who's going to be, especially going to college. There's going to be a lot of new people. Some of them may be at risk, and I really wouldn't want to put them in danger, or anyone else, even if they aren't at risk, because everyone is really in some danger of the virus. So I just want to make sure that everyone is safe in that way as well.
That's just so great to hear, Ethan, and that's very commendable of you, and appreciate you helping to keep others safe, while also keeping yourself protected and being able to do the things you love. Because again, that's what we all really want to get back to, is doing those things we love. And some of that is even just in-person learning, and especially in college and all those opportunities. So thanks, Ian. We are going to have you back after Leah gets to speak, and we'll have you back for the Q&A session. So thanks, Ethan. All right, the third high school student I am excited to introduce is Leah Dozema. Leah?
Hi.
Hi.
For having me.
Thanks for joining us. So Leah, you are also a senior in high school, and during your high school years, you've been actively involved in the National Honor Society and Students for Environmental Advocacy, as well as the Writing Studio. I was also really excited to learn that you are an athlete on the track and field team, and that you'll be attending the University of Michigan to study human biology in a pre-med track, and you will also be on scholarship for the track and field team at the University of Michigan. So that's congratulations. That's quite a few big accomplishments, and I went to the University of Michigan too, so go blue.
Oh, go blue.
So Leah, tell us about your experience and your perspective on vaccination, and what did you ultimately decide for yourself?
Yeah, so I actually had a very similar experience to Ethan. Since the beginning of the pandemic, I've been very excited to hopefully be vaccinated someday. On April 5th, when our age group were able to be vaccinated, I was searching to find a vaccine, and I was able to get one, I believe, on April 7th. And I will be fully vaccinated this Friday.
Oh, that's great.
And a big reason why I was vaccinated, well, as an athlete, I just feel more comfortable now going to track meets and competing. And it also gives me a lot of freedom, especially as a fully vaccinated individual. I do not have to be tested weekly starting next week. And I am safe from being contact traced and quarantined because I'm fully vaccinated. So that just gives me it's honestly very convenient to not have to worry about whether I'm going to be missing out on a track and field event and any other opportunities with track and field. And of course, as a graduating senior and looking on to next year, being vaccinated, I don't have to worry about whether or not I will be able to receive my high school diploma in person. I will be able to attend and I will be able to be there in person, which is huge and very important to me. And then also at the University of Michigan, in order to live in the dorms and to also be an athlete on their track and field team, they require you to be vaccinated. So as a vaccinated individual, I'm going to be able to live in the dorms. I'm going to be able to have somewhat of a normal freshman year, which is also very important to me and many other people around me. And I think most importantly, what really led me to be vaccinated and felt that it was very important, not only for me, but for the people around me, is that I have seen the scientific progress that has went into the production and the how it's been given out, the vaccine. And I feel like I am doing my part to protect the people around me, to protect my loved ones, to protect people I don't know that I see at the store, in the street. And I also feel like now that I'm vaccinated, if I was somehow I got the virus, I wouldn't have it as extremely as if I was not vaccinated, which also protects hospitals from being overwhelmed, as I know that the healthcare system has been extremely overwhelmed in the last year and a half, and I would never want to be a reason that took place anymore. And to speak on the hesitation that I have heard, as well as Ethan touched on this, I think a lot of the hesitation I've heard is mostly the fear about how fast the vaccine has been produced, and also the fear of having a negative reaction to the second dose in particular. And personally, whenever I hear these hesitations, I try to remind people of why the vaccine was produced so quickly with Operation Warp Speed, and how it was given an emergency authorization, and how the reason why that happened and how it was produced so quickly was because everyone was dedicated to making this happen, because everyone is ready for COVID to be over. So yeah, I'm really glad that I was able to get vaccinated when I was, and as quickly as I was. And I'm really excited to get back to somewhat of a normal routine.
Leah, thank you so much. And I can honestly say on behalf of all of the healthcare workers, just knowing that you're taking us into consideration and trying not to be a part of the overwhelming of the healthcare system is just really commendable. And we really appreciate that, because it's been a really tough year, last year and a half for all healthcare workers and systems. And, when you're in the middle of a pandemic or starting a pandemic, you're the first ones to get hit, and we're going to be the last ones out. So, there's really the more we can all do to help each other is just so much appreciated. So great job, Leah, and thank you for sharing your perspective as well. And I'd just like to commend all of the students that we just heard from. You guys have adapted to so much change over the past several months, and I can't wait to see what you do in life, because I just think there's some really resilient skills you guys have been building. So now I'm going to ask everyone to rejoin us for the Q&A session. As a reminder, if you are a reporter, you can submit your question through the Zoom. And if you're watching us on Facebook, you can submit your question that way, and we will get to as many as possible. So the first question I'm going to look at here is for Dr. Nefsi. So Dr. Nefsi, Leah just mentioned, some people are worried about a reaction, and specifically to the second dose of some of the vaccinations. Can you help explain what the risk is of, getting a reaction like that for maybe a couple of days versus having the disease itself? And are there different risks? Would the timeline be different? Because I just know that one of my relatives actually had COVID-19, and he had a fever it was over 10 days. But yet when he got vaccinated, he only had a reaction for maybe 2 days. So he obviously got vaccinated after he had COVID, but so is that kind of typical? And is that one of the other reasons why it's better to get vaccinated? Because if you do have a reaction, it'll be a lot shorter.
Well, I think it's important to understand that, the symptoms you get when you have COVID are different than a side effect of getting the vaccine. So when we take the vaccine, it really triggers your immune system to recognize the virus. So that triggering of the immune system can cause people to have a reaction. It could be low-grade fever. It could even be a higher fever, soreness in the arm, just not feeling good, headache, that kind of thing. That's just your immune system really kicking in and starting to recognize, oh, here's something that I need to know how to fight off. And it's not uncommon at all with other vaccines, to have those side effects. I was prior service military. I had a lot of vaccines in my lifetime, and I can tell you some of the side effects are pretty significant. But that's just the way that they work, and it's important to recognize, okay, this is my immune system kicking in. That's very different from getting ill and the symptoms that you get from actually getting the virus. What we know about COVID, again, is, some people get very sick, some people don't. We don't know, there's no predictive way really to know who is going to get significant illness from COVID-19 and who is not. We know that there are some risk factors with our elderly, but as we see more and more kids, there's really no way to predict who's going to have, a bad illness from getting COVID-19 that requires hospitalization or worse, and who doesn't. The other thing that we are learning more about is sort of what they're calling kind of the long haulers. There are some people that are getting really prolonged effects from this virus, weeks and months out. That is another one that we really have no way to predict how that's going to happen. So, really side effects for 24 to 48 hours from a vaccine versus, the broad spectrum of what can happen from, mild symptoms to long hauler symptoms to hospitalization or worse with getting the vaccine, I think is a pretty clear balance of what the safest thing to do is.
Great, thank you for further explaining that. So this next question is for all of our students. So I'm going to just call on each of you to answer this one. But are your friends getting the vaccine after hearing about your experience? Have you shared your experience with your friends? And do you know if, have you had questions from them or any resistance or other people, getting their vaccine because they saw you get it? So Olivia, I'll start with you.
I personally haven't shared my story with anyone because it's not super accepted. But I do have a lot of friends that are getting the vaccine.
So you're feeling that cultural sort of and sort of that peer pressure in some of the community where you're at. So that's interesting. So that's thank you for sharing that with us, Olivia. We if you haven't shared that more broadly, it takes a lot of courage to get on a press conference like this. So we appreciate that. Ethan, how about you?
Yeah, quite a few of my friends, if not like most to all of them, have been getting vaccinated, which is really exciting. I haven't really had to convince them or be like, hey, you should really get the vaccine to any of them, which I'm really grateful for, that all of them are recognizing the importance of getting the vaccine, and yeah, getting it as quickly as they can.
That's great, Ethan. Thank you. And Leah, how about you?
Very similar to Ethan, a lot of my friends have been vaccinated, and actually this week most of my friends are fully vaccinated, and if they're not, they will be within the next coming weeks, especially after, and anyone that did feel hesitation, I think after hearing the possibilities that the things that they're going to be able to be a part of after being vaccinated has convinced them to be vaccinated, especially to protect others. So yeah.
That's great. Thanks, Leah. So that's a great segue into another question that's coming in from Facebook. First of all, one of our listeners wanted to share that this has been absolutely wonderful listening to the young adults. So kudos to you guys for joining us today. But I know some of you have already touched on this a bit, but what is the one thing that you're looking forward to doing once you are either fully vaccinated or, because Leah, you said that you're getting your second dose this Friday, right? So, so once you're fully vaccinated, what is one thing you're looking forward to doing that you really can't do now? So I'll start with Olivia.
I'm very excited for going back. Once everyone's fully vaccinated, going back to no masks. Because there's a period, I know that'll be a while, but there are days where I go to school for 8 hours and then I sometimes work for 8 hours and it's just so hard to breathe. And then there's headedness, and I just can't wait for the day where we don't have to wear those anymore. But I'll persevere for the time being.
Great, thanks. Ethan, you're wearing a mask there. How about you?
I'm really excited to be able to travel again because that is something I've done quite a bit, and it was a really amazing experience for me. And so whether that be an exchange program through college or to visit some of my friends who lives in other countries. I just feel like that's a very exciting thing that I've kind of had to miss out on because of COVID, but hopefully I'll be able to get to do that relatively soon.
That's great. Thanks, Ian. And how about you, Leah?
I'm really excited to be able to go to college next year and live in dorms and meet new people and have new experiences that I know that a lot of people this year, a lot of freshman college students this year are not able to have. And hopefully those now sophomore students will be able to also have similar experiences that I will next year. Yeah, I'm really excited to have a freshman college experience.
That's awesome. That's exciting. Everyone, yeah, deserves that. If you're, especially, you guys have got, like I said, you guys have been through so much. Dr. Nefsi, can you address the mask wearing that Olivia mentioned? Will there be a day when we don't wear masks, or do you anticipate that some people may still wear them? Like, I'm even thinking, because I used to do a lot of international travel in my previous profession and jobs, and I would always see people wearing masks, and I was always kind of afraid of them because I thought, oh, they must be sick, and they're wearing it. But it's definitely been adopted in other countries, much more so than the United States. But
Yeah.
I'm actually thinking, well, I didn't get the flu this year either, so maybe that mask and it did something. What do you foresee for the future?
It's a great question. I mean, like you, I lived 4 years in Japan, and it's very common in those countries for people to wear masks, especially in public places, crowded downtowns, trains, that kind of thing. You mentioned the flu. The flu thing's been very, very interesting from a clinical perspective to observe this year, how we've had virtually none. The rates of influenza have been incredibly low. And we do think that that is in large part from people wearing masks. So I do think you will see some people who adopt that. In many of the Asian countries, when they get the sniffles or anything like that, they wear a mask out of respect for the people around them, so they don't spread anything to those other people. I think we'll see probably in this country people who adopt that, and I think you'll see other people who maybe when they're on trains or on planes or in some of those public places, especially during flu season and some of those other things, wearing a mask to protect themselves as well.
Right. Again, I think that'll be a very personal decision, but an interesting one that we'll see play out. So
Yeah.
thank you, Dr. Nefsi. The next question is for our high school students. So I'm going to start again with Olivia here. How important was or is social media on your opinion of vaccination? Was it more or less important than doing research on the subject of your own and trying to find other experts? And what more can the healthcare community do to reach your age group to encourage vaccinations via social media? It's a long question, but a good one.
Yes. Social media had a great influence on my personal opinion of getting the vaccine or not, because in some sense that was the only research. When I'm bogged down with all the senior schoolwork and whatnot, and I'm just scrolling through Instagram, sometimes the only thing I'll see about a vaccine is something that someone posted, and that typically has bias with it. And then obviously just what the healthcare can do is continue to post the truth and what is true about the vaccine and how it will help people, and that it's not as political as people make it out to be.
Thank you, Olivia. Great answer. Yeah, you guys are really busy, as are most high school seniors. So I know that's where a lot of people are getting their information from. What about you, Ethan?
Yeah, I tried to get as much of my information from viable news sources. Although I definitely did receive quite a bit of information from social media about it. But I was pretty dead set on getting it regardless, just because I had that trust, as I mentioned earlier. So it didn't really play too much of a factor. If I found something that seemed mostly informational and didn't seem to have a lot of bias, that supported the vaccine, sometimes I would share that. But otherwise, yeah. But I think it definitely is a really big source of information for a lot of people. And I think it's really hard to reach different people because of the way that social media acts as an echo chamber where you only hear what you want to hear. So I think maybe not even going about it directly in the sense of vaccination, but just promoting general education about healthcare and about medicine to a wide audience, and saying, hey, it's important just to stay updated on the way that healthcare is going in your region would just promote people to maybe follow Munson in general, and then through that they'd hear about vaccines and other important updates.
Thanks, Ian. And again, I encourage everyone to go to munsonhealthcare.org as a source of the facts and trusted information as well. In fact, I heard someone, I was outside over the weekend, and I heard someone say that Munson Healthcare doesn't have any COVID patients. They closed all their COVID units, and there aren't any patients there anymore. And I said, I have to, I have to correct that. We still have quite a few patients and quite a few sick individuals. So again, looking for trusted sources is a great recommendation. Leah, what about you? How has social media impacted your decision?
Very similar to Ethan once again. I try really hard to not let social media be my only source of information and not let social media be the only thing that forms my opinions. I personally have had a lot of classes in high school that have taught us a lot about researching and finding sources that are not only strong but credible. And actually in one of my classes, we did a whole study on the vaccine, and we researched, we looked between sources that were credible and sources that were uncredible. And a lot of the sources that were uncredible were heavily biased and often blog type websites. Whereas a lot of our credible sources that we would use were through the government, whether that was at the federal level or the state level. So once we did that, a lot of us, individually, I feel like I tried my best to only use credible sources on the state level and the federal level to form my opinions. And same thing as Ethan, have that level of trust in the healthcare professionals and scientists that have been working day in and out to provide something that is safe and effective against COVID-19. I do think that social media is an effective way to put information out there, but I also think that it's social media is also something that things can get lost in translation. So as much as I do think it's important to promote the vaccine on social media, I think that when that's done, it has to be done in a very careful way that's very direct, and doesn't have a lot of room for misinterpretation.
Mm-hmm.
And I think that's something that has also been very exciting throughout this vaccination process. It's something very simple, but those stickers that you get when you get your vaccine, I mean, people have them on their phones, people put them on their shirts. So it's just like, it's almost like a communal feeling that you have that, all right, like we're in this together and we're actually trying to have an end to it at some point, which obviously it's going to be a part of our lives for a long time, but just a sense of community in that we're trying our best, I think is very important.
Wow, great answer, Leah. And again, it's such an interesting world we live in right now with social media. So thank you all for sharing your perspectives on that. So we're just about out of time, but Dr. Nifsi, there are two questions that I do want you to just very quickly address before we wrap things up here. Can you address again whether the vaccine prevents the spread of the virus, or does it only protect the person who was vaccinated?
Well, it's a little bit of both. So certainly it protects the person vaccinated once you're fully vaccinated. What we know is that no vaccine is 100% effective. So, if you take these vaccines and just to round numbers out, we'll say 95% effective. That means 1 in 20 people could still be exposed to coronavirus, get it, and then spread it. And we also know with this particular virus, some people spread it asymptomatically. So part of the reason that we're still recommending masks and that kind of thing is if you are one of those 1 in 20 and you're asymptomatic, you will prevent spreading this to other people if you wear your mask. The other thing is, we still have a very high percentage rate in our community. And so the risk of you being exposed to it is much higher. So we know that the vaccine does prevent you from, in large part from getting COVID-19. And if you do get it, from getting significantly ill from it. But, no vaccine is 100% effective. So yes, it should both protect you and slow down the spread.
Great. Thank you, Dr. Nefsi. And one final question. Someone just wants a little bit more clarification. I know you mentioned this earlier, but when do you anticipate local appointments will be available for the 12 to 15-year age group for Pfizer?
Well, we are waiting for the ACIP recommendation, which we expect to get tomorrow. And I anticipate that's when people will start scheduling those, appointments for our 12 to 15-year-olds.
Great. All right. Thank you, Dr. Nefsi. It's always a pleasure to have you on and to hear your clinical perspective. And I really want to thank Olivia Ludka, Ethan Rowe, and Leah Dozma for joining us today. It was just a great different perspective we've had on these press conferences. I wish you nothing but success in everything you want to do and in every, the areas you'll be studying and your experience in college. So just three incredible individuals, and we appreciate you sharing your stories and looking forward to having you back if you ever want to join us again and share your other thoughts. So just want to say thanks to everyone. And I think, Ashley, we usually put up that one final slide as a reminder. Follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. We just had a great conversation about that. We'll share some great factual information on those platforms. Please also sign up for our newsletter. Visit us at munsonhealthcare.org. And as a reminder, our Ask a Nurse hotline is still open, 231-935-0951, and you can call to ask any of your vaccine-related questions to one of our nurses. Thank you, everyone. Wishing you all well and have a great rest of your day.
Thanks, everyone.
Thanks.